Hi everybody, Ollie here and welcome back to another one of these weekly recap diary thing videos. I apologise right at the offset, I'm coming down with a cold, so I sound really stuffy and hoarse. Please try to ignore that, we'll make it to the end. So on Monday we started the second block. So the first block was health, metabolism and homeostasis. The second block is blood, heart and lungs, so we're moving on to a kind of completely different area. And it started really differently than I was kind of expecting. Well, actually one part didn't, so between Sunday night and Monday morning I counted that I got 152 minutes of sleep, and this was before one of the first days of the block when we were in from 9 till 5:30, kind of solidly in lectures. That was a mistake, that was a very hard day. But what I was going to say was that the introduction to the second block, it seemed, at least in the first couple of days, to be very little about medicine. It was more about things like the physics of gas movement and fluid dynamics. The reason I got so little sleep was, you know how last weekend I mentioned that I was doing a lot of photography and filming for the review? What I decided to do was try and get as much of that content up to Google Drive so people could access it as quickly as possible. So that meant going through, I took, I think, between 4,000 and 5,000 photos over the 2 nights. You know, a small percentage, maybe 10 to 20% of which were actually useful, but that took a lot of manual selection, you know, just to get the ones that were either in focus or, you know, nicely dynamic or just interesting. And actually for the enjoyment that people got out of those, I think it was well worth it. So, you know, one night of sleep in exchange for that, I think, is a pretty good trade. Just to jump back quickly once again, so the reason that we've had to start this block with all those kind of mechanics lectures, I think a decent way of looking at why these things might be important might be just to consider if you have a fluid going through a pipe, say water through a hose pipe, and then you were to obstruct part of the tube, how does that affect the flow of the liquid moving through it in terms of its velocity in one direction and the turbulence and things like that? It does become really important when you're considering oxygen delivery to tissues. And in the case of, say, blocked blood vessels, how might the body compensate in order to make up for those changes? Because it's not just a static system. You know, if you get a bit of obstruction, your heart will start to pump harder in order to overcome it, but then it's about considering what long-term effects that might have for someone's health. So something else that happened Monday afternoon, we had a careers talk, which was really interesting, and it took us through all the various things that will become relevant when we're applying for our first jobs as foundation doctors. So you finish 4 years of medical school, then everyone that finishes in the UK has to go through a 2-year foundation period, wherein you're called a foundation doctor, and after that, if you want, you could go straight into specialty training or do something else. And I find these talks really interesting. It's a long time in the future. You know, obviously everyone's aware of that, but I think a fairly large percentage of people on the course, including myself, we're very kind of goal oriented. So even if you know it's a long time off, if you have something to aim for, it makes it so much easier to actually achieve things, I think. And we were actually informed about a scheme that Warwick University runs called, I think it's the URSS, Undergraduate Research Support Scheme, which, provided you can find a supervisor for a project you want to do over the summer, they'll provide help and funding for that. And, you know, now's a good time to talk about this. I want to spend this summer doing some research again. If possible. This past summer I didn't do anything of note really. I just took the time off to prepare for going to med school and had holidays and things like that. The summer before I was doing iGEM, which I really need to make more videos on, the International Genetically Engineered Machine Competition, and that was a whole summer, well it was nearly 3 months by the time we were done, of genetics research, and I really loved it. I felt really in my element there, and I want to get back into doing some research this coming summer. At the moment, I'm looking to do potentially something else using synthetic biology, so that could be trying to engineer some sort of antibiotic producing bacteria or something like that, or have a look into genomic medicine. I'd like to use my background in genetics to do something, or equally do something a little bit different, maybe looking at like care of surgical patients or something like that, something that might be relevant to my future if at all possible, but obviously it's so early, it's difficult to know what that might hold. So Tuesday we actually went through the ideal gas laws once again, which we did both in A-level physics and chemistry. I think we did PV equals nRT and the derivations for those. So that really took me back, and it all becomes really important when you're considering gas exchange, so that's back. We also had a talk on the different types of doctor-patient relationships. So I think the classical one that everyone will be familiar with is a sort of paternalistic kind of idea where doctor prescribes, you take, and there's not really any questioning involved. I think when you get that image of like the 1950s, doctors were very much on a pedestal, and the public just kind of did what they said unquestioningly. But that's starting to change a lot, obviously, in recent years, as it becomes more of a sort of consumer approach, and people have a lot more rights, as is completely correct. The most common one is called a shared model, I think, where I think the way it's characterized is that the doctor and the patient both kind of come together as experts in their own domain. Obviously, the doctor should, in theory, understand the medical basis of disease, but the patient knows their own body and their own life and kind of what's important to them. So those two people work together in order to achieve a common goal of making the person feel better. And there is a third way that we were taught about, which I found really interesting. I don't find it particularly compelling, but it does apparently happen in a small number of cases, called the informed model, where it kind of defines the purpose of the doctor to inform the patient appropriately about all their options and the potential outcomes, but it places all the decision-making burden on the patient. And from an autonomy standpoint, that's obviously, I think, optimal. No one would disagree with that particularly. It puts the patient completely in charge of controlling their own healthcare. The problem that I have with it at the moment, or the reason I would not be a massive proponent for it, is that given the very resource limited and time limited consultations that doctors are likely to have with a patient, I just don't see it as practical that a doctor would be able to communicate everything they understand about the condition and the risks and the best choices, well, not even the best choices, but all the choices available. I don't see how you'd be able to communicate that in such a way that a patient would understand it as well as you did, and was therefore able to make their own decisions. Like, it's very idealistic, and I appreciate where the viewpoint comes from. It would be great, I think, if that were able to happen. But in reality, maybe in private healthcare systems where you are paying for a product, but I just don't see it happening in the NHS anytime soon. That afternoon, actually, this is completely by the by, but it was something I noticed and I think is really valuable to reflect on. We had a lecture on ventilation and perfusion, so kind of getting oxygen to tissues, basically, and I was starting to nod off by the end of the day, as sometimes you do when it's been a day of very dry material. But the thing that I noticed, and I was starting to fall asleep towards the end of the lecture, but then the lecturer did this interactive demonstration of one of the principles using a box of chocolates, like a box of heroes or celebrations or something. I can't remember, but got a student up and they were exchanging the chocolates to represent oxygen delivery into blood or something. But I remember waking up completely and being really, really focused. So despite not having taken, I hadn't taken a caffeine tablet or eaten any chocolate or anything like that, the sort of thing that you would normally do to kind of perk yourself up, it was completely based on how the material was being delivered, and I thought that was really interesting. That tells me that if I'm in that position of teaching something like that, that I need to make the material at least partly interactive, just because then you recapture a bit of attention back, and at least from my perspective as a student, I really appreciated it. Wednesday was quite funny in that we had a talk from the GMC, which the reason it was funny is that when you get to med school, like when you first start, you start hearing all these kind of horror stories about the GMC and fitness to practice committees and people getting struck off for really kind of pathetic reasons, and it becomes a bit of a bogeyman situation. You never take any of it that seriously, but you do always kind of have this feeling in the back of your mind. I certainly do, even since getting here. We've only been here 6 or 7 weeks, and whenever you do something, you always have that, is it feasible that this could come back to me in some weird way 2 years down the line and the GMC could strike me off? And so we had these two speakers in to kind of, it was this talk like why not to be afraid of the GMC, basically. I did appreciate it. I think about half the cohort actually stayed around for it. It was completely non-compulsory. And to be honest, those of us that did stay, I'm not sure I feel any better about them afterwards. They seemed like lovely people, but yeah, that was a bizarre experience. We actually finished at 12:30 on the Wednesday because we still, as often as possible, are given the Wednesday afternoons off to go and do other activities like sport or societies or whatever. I actually had my student seminar at 6:30 that evening, so I stayed on campus just at the medical school and worked right through until the seminar. I've got 2 new teachers from second year. I wasn't sure how that transition was going to be, given that I really like the teaching style of the people I've had previously, but these new 2 were fantastic as well. And actually, I don't regret having the variety, because that's kind of why I enjoy the seminars anyway, in the variety of diagrams and teaching methods that you got. And a lot of the methods we were given in this session were really, really useful and helped me to really be confident in the anatomy sessions on Friday, which I'll talk more about in a minute. But yeah, that went down really well. So Thursday morning, we started a new CBL case. We have now switched into the second time slot. So the way CBL is done, if you imagine on the Thursday morning and any time CBL happens, it's basically 2, or is it 3 slots back to back? It's like 3 hours where I have no idea what that noise was. The way it basically works out is that one half of the year has the first half of the morning to go in and use the seminar rooms, and then it swaps over for the second half. Up until now, my group has been in the first half, and now we're in the second half. So we have the first bit of the morning to do some work if we want, and then we can go in and have our session. But it's a completely new set of cases. We have a new facilitator this time around, and I feel like this time we approached it much more methodically. We were trying to really second guess the learning objectives. So let me just run you through the case here. I've got it here on my phone, forgive me for using a prompt, but I've got a bit of a headache. The patient arrived in the emergency department having been sent by his employer. He'd experienced breathlessness, congestion, woolly headedness and a headache. We kind of got the idea this was due to sinusitis. So the way we kind of went about this time was going, right, what's the relevant anatomy? What are the sock pop perspectives of this? Things like his employer had sent him to the emergency department and sick leave, things like that. So we did the anatomy of nasal cavities, paranasal sinuses, and the external and middle ear, which are all kind of relevant in these cases because he'd lost his sense of balance. We were also taught a really, really good mnemonic for remembering what each cranial nerve is, and this is a thing I want to talk about, right? Dirty medical mnemonics. The lecturers keep kind of alluding to them, and if there is a particularly good one for a particular topic, they will say like ask older students or something as to what the mnemonic is, because they obviously can't really tell us. It would probably break some sort of code of practice, but they work extraordinarily well, and I'm going to make some videos, I think, on the best dirty medical mnemonics. They probably won't be ad friendly, but they are really, really good, and you should hear a few of them. And we finished the Thursday with a look at innate and adaptive immunity. Now, I didn't really enjoy immunology very much during my undergrad at Newcastle. I only had one module of it, but I think it was one of the more difficult ones in my degree. I scraped a first in it. I think I got 70 bang on in immunology, but this time I was a lot more receptive to it. I was absolutely wired out of my mind on caffeine and was scribbling notes out like a madman, but I actually really enjoyed it. And maybe that's the key. Maybe just being hyped up is the key to taking it all in at once. So on Friday we were back in hospital once again, still my favourite day of the week. Anatomy, first thing, doing the nasal cavities, the middle ear, the external ear, and again, just because there hasn't been a lot more material to read up on, I've been able to go quite in depth with it. I've really enjoyed it a lot more. Like I was quite confident in answering all the questions and things like that, and that felt really, really good. I think it kind of generates this positive feedback thing where if you do the pre-reading, you're a lot more confident in answering the questions and taking new material in, which then makes you feel better about the knowledge, so you want to go and learn more, and then I think that could be a really good routine to get into. It's just keeping up with it. There was also a station where one of the demonstrators used Minecraft he'd built this enormous skull, like a transparent skull, in Minecraft, and was using it to illustrate where the paranasal sinuses are, so frontal ones here, maxillary ones here, and I'll put a diagram into the video, but it was really, really cool. There was something really innovative actually. One of the demonstrators used Minecraft, the kind of block building game, to illustrate where the paranasal sinuses are inside the skull. Some of them are a little bit difficult to visualize. They're kind of air pockets basically, that make the skull lighter. They're big holes essentially on the inside of the skull, but as a result of that they can become infected and kind of clogged up with mucus and things. And he built this enormous skull and then kind of highlighted using coloured blocks where they sat within the skull in 3D space, which was really cool. I've never seen that done before, and it's really something interesting to think about. Although he did mention that he needed to ask his son how to turn off the in-game rain, because that was happening from time to time, but super interesting. And also something I think very positive, I went back at the end of the session and asked one of the consultant surgeons who teaches us, I was basically asking, like, if there were some procedures, as someone who is interested in seeing some, like, what should I be looking out for? What should be, like, the hallmark things that I should try and see? He gave me the contact of someone to talk to and just said, like, see everything you can. So, yeah, that's going to be the plan, see as much as possible. We had clinical skills in the afternoon. This week we were looking at respiratory exams, and so we started the session just by going over the general history taking again, and I did really badly this time. Unfortunately, I mean, over the last few days, as you can maybe tell from how I sound now, I've been having kind of weird flu symptoms, sort of a blocked nose, very headachy, and by Friday afternoon I had a really bad headache and felt a bit sick, and I just missed loads of obvious things that I should have been getting from the patient I was interviewing, but just skipped past them, and that was bad. The problem is, I was going to say I really need to be more on form, but it's not that I wasn't on form, I was afflicted, so I don't know, it was just unlucky. But after that we moved on to kind of general chest respiratory exams. They wanted a volunteer model. You had to be shirtless to do it, so for about, I don't know, a good hour I was just sat shirtless on this examination bench while I was being prodded, because the way the session was kind of done was they got two of us up, so there was me as the patient and then someone else as the doctor kind of examining me, and then everyone else in the room was supposed to tell him what to do, but because no one had ever done it before and the instructions were a little bit unclear, I was kind of being mauled around a bit, but it was interesting, and I think the one thing I can take away from that is I know how it feels if it's done badly, so that should tell me. So that should tell me kind of what sort of things to be careful of when I'm examining someone else in the future. We also went to a house party on Friday evening, which I really, really enjoyed. I came very close not to going at all just because of how kind of sickly I felt. But we did go. It was really, really fun, actually. There were maybe 30, 35 people there, just from first year. But it was really cool just to sit and unwind and talk about something else other than med school. I also played beer pong for the first time in my life, and it was also an extremely long game just because the two of us, well, it wasn't just us, there were about three of us on each side, but we were all awful, so the game just went on and on and on and on and on. We did win in the end, so it was well worth it. And one of my course mates, actually, because of where he lives, it's difficult for him to get home very late. It was like 1:30 or 2 o'clock or something, and so they said, why don't you come and stay on our sofa downstairs? So he came back with me. A few other people went out in Leamington, but I was just kind of done by that point. And so my course mate falls asleep on the sofa. Kind of, we're just talking, both like chilling out in the living room. He falls asleep midway through a sentence. And then I'm not quite sure what's happened, so I just wait around for about 15 minutes. Just to like make sure he's okay. And then I was gonna kind of put a blanket on him and go to bed myself. As I go to do that, he wakes up and then finishes the sentence, which is one of the most bizarre things I think I've ever seen, like word perfect. So maybe he's got a weird brain, I don't know. And now it's Saturday evening. It's about 8 o'clock at the moment, and yeah, I've done absolutely nothing today. I slept kind of right the way through. I woke up about 11:45 this morning, then got up. It was kind of like, I felt very, very weary. I got up, had something to eat, so I was really, really hungry. And then I sat back down, like on the end of my bed to get dressed, and clearly must have like lolled back and just fell asleep again. Woke up about 3 o'clock. So I've not done an awful lot today. So basically all I've done is been to the supermarket in Leamington, brought some food back, and have done some meal planning for the week and some exercise, because I feel like when half the day is gone, just whittle down my task list to the bare essentials of things I want to do and then do them. I'm going to be busy tomorrow, that's why I'm filming this video today. But that's about where we'll wrap this up, guys. I do have some Q&A videos in the making. I'm just scripting them at the moment, but they'll be with you as soon as I can get them done, because I do want to get those out to you as soon as possible. Thanks very much for watching. Please be sure to hit that like button for me. Please leave a comment, subscribe to the channel, and go and check out PostGradMedic if you'd like to see more useful hints and tips for getting into medical school, or learn a bit more about what I'm getting up to every day here. Take care, and I guess I'll see you next week. Bye-bye.